Welcome back to Diabetic with Files. I'm Dr. G. Today we're gonna kind of piggyback off the last episode. We're gonna talk more about the power of hyperbaric oxygen therapy. I had to look back and see if I did an episode on it because everybody knows I love me some topical oxygen, but I don't think I really went deep diving into pun on words, right? On hyperbaric oxygen therapy. So, what if I told you that one of the most powerful tools to help save a diabetic limb doesn't involve a scalpel, but it should, usually does, doesn't involve antibiotics, but instead it involves pressure. Kind of like that song by Queen, right? Under pressure, technically, right? And oxygen. So today we're going to step inside the chamber, literally. I've been on a pun game today to explore one of the most debated, powerful, and actually misunderstood therapies in wound care, hyperbaric oxygen therapy. So, what is hyperbaric oxygen therapy? For me, when I first heard about it, I just thought about Michael Jackson. That's what I thought about, okay, when I first learned about it, because that was my first introduction to hyperbaric oxygen therapy, because that was the chamber and it was on one of those tabloid magazines. So, that was my introduction. But hyperbaric oxygen therapy, HBOT, is the treatment where a patient breathes 100% oxygen in a pressurized chamber. Typically, it's at 2.0 to 2.5 atmosphere absolute. So they call atmosphere absolute ATA. So to simplify it, the normal air that we breathe is 21% oxygen. So that's at 1 atmosphere absolute ATA. Hyperbaric oxygen is 100% oxygen at 2 to 3 times atmospheric pressure. So this dramatically increases the oxygen dissolved in our plasma, not just carried by our hemoglobin. And the key factor is even if the hemoglobin is impaired, just like in diabetes, oxygen delivery continues through the plasma diffusion. Let's get a little bit into the history of it because it started all with physics and curiosity. So, they know Boyle's law, but it actually started in the 1600s. So in 1662, Nathaniel Heeshaw, he built the first pressurized chamber and they used the compressed air to treat lung diseases. And then in the early 20th century, it was used for decompression sickness, aka the bends in divers, and then tunnel workers, Cassion's disease. And then in the 1950s, 1960s, surgeons began using hyperbaric oxygen therapy to improve tissue oxygenation during operations and recognized its effect in wound healing and infection. Isn't that amazing? Don't you just love medicine? Because it's really nice when people their goal is actually to heal the patient and you discover something. It's like a win-win. I love that. So now it's, formalized by organizations like the Undersea and Hyperbaric Medical Society, forgive me. So Undersea and Hyperbaric Medical Society. And today hyperbaric oxygen therapy is an evidence-based adjunct, adjunct, less capitalized adjunct therapy, especially in chronic wounds like diabetic foot ulcers. So how does it work? If you like physics, you'll understand it. So its core hyperbaric oxygen therapy is governed by gas law physics. So things like Henry's law. So Henry's law says the amount of gas dissolved in a liquid increases with pressure. So what happens in hyperbaric oxygen therapy? The patient breathes 100% oxygen. The pressure increases to 2 to 3 ATA and then the oxygen dissolves directly into our plasma. And what would be the result of that? The oxygen delivery becomes independent of the hemoglobin because remember we use hemoglobin, it carries the oxygen, right? And oxygen penetrates even the ischemic and poor perfused tissue. So what are the therapeutic principles of hyperbaric oxygen therapy? So the core biological effects of hyperbaric oxygen therapy, hyperoxygen oxygen oxygenation. Oh my gosh, I can't believe I got tongue tied. I mean, it's like almost midnight. Hyperoxygenation, and this increases tissue oxygen tensions up to about 10 to 20 times more, okay? And then reverses hypoxia in chronic wounds, and that's one of the biggest things that we want because remember we said oxygen is a currency. Now, next thing that it does is it does promote angiogenesis. Angiogenesis, what is that? New blood vessels, okay? So it helps stimulate VEGF, so FEGF, okay? And then it helps endothelial cell proliferation. So it's critical for long-term wound healing. Next is it enhances collagen synthesis. Remember, fibroblasts require oxygen to produce collagen. So without oxygen, there's no extracellular matrix forming. And then hyperbaric oxygen therapy also improves your immune function. We already know that was a big key factor when it comes to diabetes. It pretty much imbalances your whole immune system. Your neutrophils aren't working as appropriately as it should. The glucose impairs it. It's a whole, like I said, it's like literally a domino effect, just starting from hyperglycemia, right? Which is crazy. But hyperbaric oxygen therapy actually help improve your immune function because the neutrophils use oxygen. So they use oxygen for the oxidative burst. Remember, we talked about that a little bit in free radicals and for bacterial killing. Then hyperbaric oxygen therapy also has an anti-infective effect. So directly it's toxic to anaerobic bacteria because remember anaerobic bacteria can thrive in low oxygen areas. They love one thing I do know is that anaerobic bacteria love a diabetic foot. They love to make gas. They like to make neck fast from that. These anaerobic bacteria, because they thrive in these low oxygen environments or no oxygen environments. That's why they're able to cause hypoxia, right? And then hyperbaric oxygen therapy enhances antibiotic penetration. So that's a good thing too, right? Because it's helping your perfusion, right? So it's indirectly helping your perfusion because increasing the oxygen, right? So it's allowing the antibiotic to penetrate better. Because remember, we say people who have like peripheral arterial disease, let's say they have a occlusion somewhere in the lower extremity and they have an infection in the lower extremity. Them even taking oral antibiotics, the antibiotics won't reach there because the blood flow is occluded there. So hyperbaric oxygen therapy could help with that. But remember, vascular. Then stem cell mobilization. So hyperbaric oxygen therapy also releases endothelial progenitor cells from your bone marrow. And then hyperbaric oxygen therapy also reduces your edema. So it causes vasoconstriction while maintaining the oxygen delivery. So let's break down again the pathophysiology of a diabetic wound. So we have microvascular disease where we have thickened capillary basement membranes, reduced perfusion, and poor oxygen delivery. We have neuropathy where we have loss of protective sensation, repetitive trauma. We have immune dysfunction where we have impaired leukocyte activity and reduced oxidative killing. And then we have hypoxia, a lot of chronic wounds. A lot of our chronic wounds are oxygen starved environments. That's why I told you, I said anaerobic bacteria loves it a diabetic foot ulcer. And here's the reality a wound without oxygen is a wound that cannot heal. And honestly, it's a breeding ground. That's why vascular, right? I'm going to say it 3 times and click your heels, right? Let's get to vascular. I love me some vascular. So, the science behind the oxygen under pressure. So, under hyperbaric oxygen conditions, right? The oxygen directly dissolves into the plasma. Your tissue oxygen levels increase by 10 to 20 times better, like higher. And then the oxygen can diffuse further into ischemic tissue. So, also remember last episode, we talked about controlled, reactive oxygen species, right? And then uncontrolled reactive oxygen species. So controlled reactive oxygen species, right, is helps with healing. Uncontrolled causes tissue destruction. So hyperbaric oxygen therapy creates a controlled oxidative environment that favors healing and not damage. Remember, too much of a good thing is bad, right? Like Spice Girls. Oh, I love that song. Okay, so what are the indications? This is something that you're going to need for. I believe there are 14, 14 approved indications, right? If I'm wrong, please correct me, but I believe there are 14 indications, 14 approved indications for hyperbaric oxygen therapy, okay? And so, oh, hold on. Let me just go back into the 14 approved ones. So the 14 approved indications for hyperbaric oxygen therapy is air or gas embolism, acute thermal burn injury, carbon monoxide poisoning, carbon monoxide poisoning complicated by cyanide poisoning, central retinal artery occlusion, clostridioidomyosis or myonecrosis, aka gas gangrene, compromised flaps or grafts, crush injuries, compartment syndrome, or any other acute traumatic ischemia, decompression sickness, delayed radiation therapy like soft tissue and bony necrosis, enhancement of healing in selected wound, wound problems, idiopathic sudden sensorineural hearing loss, intracranial abscesses, necrotizing soft tissue infection, refractory osteomyelitis, and severe anemia. So isn't that a long list? So let's go on to the indications of it for a diabetic foot. Okay, so what are the indications for hyperbaric oxygen therapy for a diabetic foot? Because it's not for every wound. Hyperbaric oxygen therapy is not for every wound. So the approved and common indications of hyperbaric oxygen therapy for a diabetic foot is usually Wagner's 3 or higher ulcers, like, and chronic non-healing ulcers that are like 30 days, osteomyelitis, like I said, compromised flaps and necrotizing infections. It is adjunctive therapy for that. Okay, so if somebody has a necrotizing infection, yeah, you can see if they can get hyperbarics. So remember how the Wagner scale works? So like you said, Wagner 3 and up, right? So Wagner scale is 5, right? Goes up to grade 5. Remember, Wagner scale, we start at 0, which is intact skin. Grade 1 is superficial. Grade 2 is deep ulcer. I always just say to tendon. Grade 3 is osteomyelitis or abscess. Grade 4 is forefoot gangrene. That's so easy to remember. Forefoot, right? And grade 5 is global gangrene, the entire foot gangrene, okay? And so hyperbaric oxygen therapy is most useful for grade 3 and 4. So let's explain a little bit of the indication. So when hyperbaric oxygen therapy is appropriate for a diabetic foot, let's say the wound is present for more than 30 days, because remember, most of the time you're going to have your insurance cover this. There is poor oxygenation, so your TCPO2 levels are low. There is a persistent infection despite antibiotics and post-debridement hypoxia. So what happens during a section? So there are types of chambers. There's a monoplace chamber where you put one patient in and it's filled with pure oxygen. And then they have multiplace chambers where there's multiple patients and oxygen is delivered through a mask or a hood. And like we said, the typical treatment protocol is 2.0 to 2.5 ATA. Duration is usually 90 to 120 minutes. Frequency, usually they need it 5 times a day, and sessions are usually 30 to 60 treatments. So imagine paying that out of pocket. And actually, you usually have to get medical clearance for hyperbarics, from what I remember, okay? From what I know, okay? So when it comes to cellular level, like the deep science, oxygen and gene expression, hyperbaric oxygen therapy influence the hypoxia inducible factor. They call it HIF factor 1 alpha. And then we said VEGF, and then TGF beta, tissue repair. You gotta forgive me, it's like almost midnight. And then stem cell mobilization, remember, it helps release of the endothelial progenitor cells, EPCs, from the bone marrow, and these travel to the wound sites and help rebuild the vascular. So also there's a nitric oxide pathway for this. So hyperbaric oxygen therapy increases nitric oxide, which helps improve our vasodilation and enhances the blood flow. So, in ischemic diabetic limbs, blood flow is compromised, of course, and oxygen delivery is limited. So, in hyperbaric oxygen therapy, it bypasses this by delivering the oxygen independent of the blood cells. That's why we keep on saying it does it through the plasma, right? And it penetrates the hypoxic cells. So, what does research say about hyperbaric oxygen therapy? It improves the healing rates. It actually significantly reduces major amputations and better oxygenates the tissue. And some studies have shown it literally reduces major amputations by 40 to 50%. So, and it increases your likelihood of complete wound closure. So that's why we love me some hyperbaric oxygen therapy. There are some limitations. There are because of the high cost. If your insurance will actually cover it, and then there are mixed results in randomized trials. And it is a strict patient selection. Okay, and consensus is hyperbaric oxygen therapy is not first line, but with the right patient, it is actually limb salving. Okay, and hyperbaric oxygen therapy, you have to remember, is adjunctive therapy. That means it's an add-on therapy to the whole treatment plan, okay? So it is not a standalone treatment. So hyperbaric oxygen therapy must be combined with, vascular assessment, glycemic control, infection control, offloading, debridement. You cannot oxygenate a wound that has not been properly cleaned and all the other problems have been addressed. So what are some there's something called translational and emerging indications for hyperbaric oxygen therapy. So they're researching to get more approval indications for it. So hyperbaric oxygen therapy and stem cell therapy, so enhance cell survival and angiogenesis. Using hyperbaric oxygen therapy, these are emerging now, okay? So this is not a approved indication, but emerging. Hyperbaric oxygen therapy in biofilm destruction. Remember, where they've been focusing a lot on biofilm, realizing how serious biofilm is when it comes to a chronic wound or any wound, okay? But hyperbaric oxygen therapy actually helps weaken bacterial biofilms. Neuropathy improvement. There is potential nerve regeneration effects from hyperbaric oxygen therapy. Microcirculation recovery, it actually improves your endothelial function. And then, like we said, is adjunctive to also advanced wound therapies like growth factors, skin substitutes, or PRP. So with everything, they have their benefits and they have their adverse effects. So what are some adverse effects of hyperbaric oxygen therapy? You can get air, borrowed trauma, you can get sinus pressure, you can get fatigue, you can actually get temporary myopia, and I know I'm pronouncing that a little bit wrong, forgive me. And then rare other and serious adverse effects, but these are rare: oxygen toxicity, seizures, pulmonary borrowed trauma, and claustrophobia. Claustrophobia is actually quite common, but those would be something that would be screened before you get cleared, okay? Like if you're claustrophobic, I don't think that this is the best thing for the patient. But it depends. The people will clear you, and let you get actual medical clearance. Like I said, it's a strict selection. So what are some contraindications for hyperbaric oxygen therapy? There's one absolute contraindication, and then there's relative contraindication. So the absolute contraindication for hyperbaric oxygen therapy is untreated pneumothorax. Okay, that's going to be on boards. Untreated pneumothorax. I believe so. Okay, that's something to remember. What are some relative contraindications? COPD with carbon dioxide retention, upper respiratory infections, certain chemotherapy drugs, and seizure disorders. So when it comes to clinical decision making, like when should you consider saying, oh, maybe talk to your doctor about hyperbaric oxygen? Okay. Is your wound hypoxic? Is it a non-healing? Ask for standard of care. Is there a deep infection? Do you have osteomyelitis? Has vascular supply been assessed? So let's do a quick little real case scenario. 62-year-old diabetic male with a plantar ulcer, exposed bone, poor healing for 6 weeks. You debride antibiotics, offload, no improvement. Hyperbaric oxygen therapy becomes adjunctive therapy that shifts the trajectory and helps close the wound. So, in conclusion, like we said, oxygen is the currency of healing and oxygen is life. But under pressure, oxygen actually becomes even more medicinal. And in a diabetic foot, we already know it's a whole battlefield where oxygen is the currency of life and survival for a diabetic foot. And without oxygen, cells die. And with oxygen under pressure, cells actually regenerate. So, hyperbaric oxygen therapy is not magic, but in the right wound at the right time, it can mean the difference between healing and amputation, okay? Hyperbaric oxygen therapy gives cells a second chance to breathe, to rebuild, and to survive. I, re- you know, I remember there was a patient who had nec- it looked like gangrene of the second toe, right? No, of the fifth toe, forgive me. And with hyperbaric oxygen therapy, because the lady showed me the picture, her toe turned back pink, like a normal toe. You would never guess that this person had gangrene of their toe. It was absolutely fascinating and beautiful. That's the beauties of medicine. Okay? And thank God for her physician to prescribe that for her and her to get the clearance and be able to do that. And that's the whole point of limb salvage. That's the whole point of limb salvage. Because if somebody else saw that, right, and they didn't have hyperbaric oxygen, yeah, they woulda cut off that patient's pinky toe. But that patient now still has their pinky toe, okay? Because in limb salvage, every molecule of oxygen matters, okay? It's science and it's applied precision, okay? It's not magic. And you know what? If you care more, you'll do more. So, if you have serious thoughts about saving limbs, understanding wound physiology, and mastering advanced therapies like hyperbaric oxygen therapy, this is where it starts. So, this is Diabetic with Files, where we don't just treat wounds, we decode them. And I'm Dr. G. It is almost midnight, and take care of your feet because it take care of you.